Thank you, Caroline. I think the work of the COVID Special Committee, we did a lot of good work, and I would like to pay special thanks to the Chairman, Deputy McNamara, and to the Secretariat also. And I'd like to also highlight colleagues on the committee who were elevated to front bench office, Minister Donnelly, Minister Butler, Minister Foley, and I'm not sure where Deputy McGuinness went, but anyway, we certainly felt his loss from the committee. The original proposition of the committee, I think on the day that it was being formed, I said that I wanted to be part of a committee that would be constructive and look forward. I understood very well, as most people did, that there were significant failings possibly in the government and social response to that date, but I felt that we need to keep looking forward because, as a number of people have said, we are not out of this by a long way yet. I would highlight some of the challenges that came up in terms of the COVID committee, and very early on we were faced with the issue of PPE, and I think great credit must go to a lot of private industry in Ireland who liaised and opened their supply chains in Asia to the HSE to get PPE into the country. We must, of course, acknowledge our frontline staff and the heroism that they displayed throughout with a significant lack of resourcing, and some of that could not have been envisaged prior. We also know the issues that came up in the nursing homes, and it has been highlighted here again tonight, but this was a new learning experience, and nobody could have foreseen where we are. We were trying to prioritise the liberty of ICU beds, and maybe in that was the failing of transferring people from the hospitals to the nursing homes without having adequate testing in place. But with respect to testing and tracing, I would also highlight Ireland's call. A huge response from Ireland people, both home and abroad, expats coming back, and we had over 70,000 responses, and I think it was a great shame that we didn't utilise the people that responded to that. At the end of the day, I'm not sure that more than 800 or 900 people were actually taken on out of that, and that's a huge bank of goodwill that we should have used and we should continue to be looking at now, in my opinion. I'd also highlight the meat factories, which has been said have major difficulties, and that has got to do with convection, has got to do with conditioning, has got to do with temperature, and congregated settings came up in terms of direct provision centres as well as factory place settings. And I'd also highlight an extraordinary deal that was done in the early stage, which was with the private hospitals for surge capacity. And it's a pity that Minister Donnelly isn't here now, or I would remind him how strident he was to have that deal looked at, in terms of that, we booked a lot of bed space that ultimately wasn't required, but we didn't book the elective capacity that was there in the private hospitals, which was definitely an own goal on the government's behalf. We have now the deferral of other elective work, which is happening. And then we had the travel. We looked at travel, transport and public transport issues, and into that came mask wearing, which we should have been doing, in my opinion, and I asked for it very early on from the start. I asked for it sometime at the end of March. We also had the construction sector in, where we heard Tom Parlin tell us that we'd be seeing a 40% rise in cost to build a children's hospital. He might be proven right after all, if present evidence is to be followed. And then we had the July stimulus, and I think it was very important that we produced an interim report into that, and I think there was a lot of good initiatives that everybody contributed into in that, and the government, to be fair, and the Minister for Finance did take on some of those. We've learned a lot, I think, about NEFIT. And I suppose we have to say, and Deputy Murphy, who has gone, alluded to the fact that that was in place, and I have voiced on the committee quite a number of times frustration, not necessarily with NEFIT, but just in terms of the way access is provided to it. We heard from David Nabara of the WHO, who has highlighted the fact that, in his opinion, lockdowns are not a good step, and we are at the moment actually going against that conventional advice, but maybe we're doing it because we have to, and largely I believe we're doing it because we do not have adequate test and tracing, and we do not have adequate rapid testing in place. And I think also NEFIT, I asked the Minister, again he's left the chamber, but I asked him some weeks ago, could we provide a platform for industry to engage directly with NEFIT? There are significant thought leaders and business leaders out there, and I think their opinions could well be done with heard. And then, in respect of rapid testing, the Taoiseach was in the Enterprise Committee last night, and he spoke about the HICWA report into some of the rapid testing measures, including antigen testing, which I brought to NEFIT almost 5 months ago now. And he said it wasn't, it appeared, according to HICWA statements, that it wasn't that efficacious. And that seems extraordinary to me, and I'm wondering how many antigen tests were looked at in a pool as opposed to some of the specifics that were brought. But anyway, we brought interim tests and reports in on testing and tracing. We did an interim report on nursing homes, and we did an interim report on stimulating enterprise, and I think this was all very valuable work. But it also asks the question as to where we are now. And I would hope the government would take on the recommendations of the COVID committee, and I agree with some of the speakers already who have said it is a pity, and I've said this in the House previously, that the committee has been disbanded. And I think we probably need it now more than ever. And we had a significant amount of expertise being built up by the TDs who were present, and by some of the other senior experts. And I think it would be good to have that level of interrogation as to what is our state of readiness at the moment. And I would also highlight that we have COVID pathways now in the hospitals, which is very good from the point of view of managing and trying to defend against the introduction of disease, but at a very significant cost in terms of delays to other elective treatments. And I think we've heard largely about people who are waiting on operations, and particularly those who are awaiting diagnostics in terms of possible cancer diagnosis. And that is something that we have to get further up, I suppose, the chain of importance in the HSC. We must defend against COVID, but we must find ways in trying to deal with these diagnostic cases as well. And I've already asked the Minister to consider elongating the hours in our public hospitals, where there is large capacity after 4 o'clock to do diagnostics and imaging, if we can find a wherewithal with the workforce. Beyond that, I suppose one of the things I'd say that we have also looked at is the future economic outlook. And we have taken on unprecedented levels of borrowing, and we have also unprecedented levels now of mandated unemployment. And I think this is something we need to think largely in terms of how we're getting out of this. What is the economy going to be like? We have a large amount, particularly of our private, indigenous and smaller SMEs, and their experience, I would remind everyone in the chamber and anybody watching, is completely at odds with what is happening in the public sector. These are people who are furloughed, they're indebted. They've seen significant reductions in their pay. They are not able to get out and socialise. They are not able to open their businesses. And I think we must look again at special measures and increased measures, particularly for those sectors, and there are a number who have fallen through the cracks in terms of the stimulus that's been provided. But I think most of all now we need social solidarity. And we need to consider these further supports to the critical sectors, while at the same time reflecting that we must get on top of this disease. So I think testing and tracing is the key. I think we will have to bring in rapid testing, because it's quite likely vaccines will not be here, despite all of the optimism. It's unlikely we'll have any vaccines before April, May, June, I would say at the earliest, in any numbers. And so we are going to have to deal with the issues of COVID for a long time. And I would say, I think it's the responsibility now of everybody in this House and every citizen to try and ensure that this lockdown is the last that we impose on the people of this country. We must find a way of living and managing with COVID and keeping businesses some way able to operate, even in a very small way, as Deputy Durkin said earlier. And we must allow small people in small business and private mom and pops to be able to get some income into their store and to get some of their lives back. Thank you, Councillor.
Thank you very much.